This is Lavina again, physical therapist, and one of the things that I would share today is if you have a Parkinson's patient or a family member, or if you are the person with Parkinson's, I would recommend using a Physioball, a big exercise ball, to help with your rigidity, stiffness in the trunk, stiffness in the leg. And the ball usually is very good for patients who suffer from back pain. But guess what? This is also very advantageous for you as a Parkinson's patient. And I have a video in my playlist, and please check it out, which I indicated for back pain patients. But guess what? It is and will be a very good routine for you to just loosen up that very stiff trunk. It helps your hips loosen up, your knee, your joints, and it also strengthens your core, which is really important for posture. And because of some of the movements from the ball exercise, especially the bridging, where you lift your high knee up in the air, it really forces you to straighten up. And one of the problems with Parkinson's is that you tend to stay stooped. So with that stooping, a lot of the muscles on your front, will tend to shorten, and it will be hard for you to stand straight. And it is very important to keep that posture going so you don't fall forward and lose your balance.